Ain't nothing peculiar about the way that I was raised, and my arm is on the way.
Hello everybody. I came across some stuff last night that I thought we would go over and share. And this medical record here don't even make no sense to me. No professional or nothing like that, but I have common sense and I have logic. Alright, so it says, and I looked up these two staff names. I thought that was kind of odd. Their addiction psychiatrist. Alright, chief for complaint. Reason for visit. I've been doing real good. Wouldn't the reason for visit be for medication refills or evaluation or like, you know, what do you call it? When you go back and check up or whatever. History of present illness. Patient seen for follow-up appointment. That's what it was. Alright, patient seen for follow-up of bipolar DO and meds. Patient is in good spirits. Reported stable mood and no manic, whatever that is. Disgust, whatever, and warning signs. Wait a minute. Warning sings? Did I just Wait, hold on now. Patient seen for follow-up of bipolar DO in meds. Patient is in good spirits. Reported stable mood, no manic, whatever that is. I need to look it up. Disgust, whatever, and warning sign, or it's not how you spell signs. And warning sings in order to prevent further decompensation again.
Scientists don't do that. Can't you read the sign?
She never what? And then it says, this shows how poor concentration and attention. Concentration and attention span she has, since I review it with her every appointment. Oh, is that a doctor throwing shade? Because they don't remember something? Oh, hold on, I'm gonna be back on that. Alright. We're gonna go through some of the abbreviations of medical terms. At least John Paul is teaching us something, you know? I will tell you that. Alright, so we're going to go through some of these medical terms real quick. And then we're going to look at some records. And we're going to see the kind of BS that JP's up to with his minions and stuff. So, in mental health, MRE stands for most recent episode in bipolar disorder. For example, a person with bipolar disorder may be described as having an MRE that is depressed. Bipolar disorder is a serious mental illness that causes people to experience extreme mood swings or episodes of mania or depression. People with bipolar disorder may experience normal moods between episodes. Mixed episodes are a type of bipolar disorder that occurs when someone experiences both manic and depressive symptoms at the same time, or in rapid succession. Symptoms of mixed episodes can include feeling guilt and worthlessness. Alright, the next abbreviation for our notebook, POA in medical terms, is a medical abbreviation that stands for present on admission. It's a billing term that refers to any health condition or diagnosis a patient has when they are admitted to the hospital. A POA is important in healthcare because it helps differentiate. Y'all don't laugh at me. Between pre-existing conditions and those acquired during a hospital stay. This helps ensure accurate treatment and billing. A POA is also mandatory code for medical member claims for each diagnosis submitted in all inpatient facilities. Alright. Our next abbreviation, PT. The medical abbreviation for PT can stand for multiple things, including physical therapy and prothrombin time. Physical therapy, a type of medical treatment that helps a patient regain mobility after an injury, surgery, or disease. And then the prothrombin time. If I butcher some of these words, y'all forgive me. A blood test that measures how quickly blood clots. It's often given to patients who take anticoagulant, or like blood thinners and stuff, I guess. And a PT result that's too high or too low can indicate a number of things, including an incorrect dose of medication, alcohol consumption, or other factors. Yeah, so it's someone that takes blood thinners, aspirin, things like that. ED. Alright, now, why do we have this abbreviation if we're talking about Mica, right? Because Mica's a female. And, yeah, I mean, she was born female and she's female. So, let's go over this medical abbreviation. ED is a medical abbreviation for erectile dysfunction, which is a condition that makes it difficult to get or maintain an erection. It's also known as incontinence. Some causes of ED include conditions that affect the the circulation of your blood, diabetes, high blood pressure, high cholesterol, vesicular disease, and chronic kidney disease, and smoking. Smoking? Wait, Mica didn't smoke, did she? But they gave her nicotine patches. Oh, okay. Let's see, Mica was born female, never had any kind of change, and even if she did, she still will not have ED. JP, we know it's you. Alright, the other one, WNL. The medical abbreviation for WNL stands for within normal limits. It means that something is normal or there are no abnormalities. For example, if a medical record notes neuro, WNL, it means that the neurological assessment was normal and didn't find any issues. Alright. Next one, PMA. PMA can stand for multiple medical abbreviations, including progressive muscular atrophy, a rare neurological disease that causes the gradual loss of motor neurons in the spinal cord. This leads to muscle weakness, atrophy, and eventually a loss of voluntary muscle control. PMA is also known as Duchenne, Aran disease, or Duchenne, I don't know. And let's see, it also can be a state of mental tension and motor restlessness that requires prompt recognition and management. Pre-market approval, the regulation, oh yeah, it's talking about something with phones or whatever, an FDA or electronic devices. Let's see, I guess I screenshotted that one twice. WNL, within normal limits, we got that one. Am I going the wrong way here? Alright, we already talked about John Paul's ED. Alright, so we got the abbreviations. Alright, so now we're going to go and look at some of these records. Alright, now I want y'all to notice something. If you look here, the names. Alright. Y'all got it? Alright, now we're going to go and look at these names real quick, and then we're going to come back to... No. I guess I did not screenshot it. Okay, that's fine. We can go and look it up real quick. That's no problem. I'll re-look it up. Let's see. There we go. It's right there, see? I had already looked it up. I just didn't screenshot it. Alright. Does an addiction psychiatrist treat non-addiction patients? Okay, Miss Tracy. No. Addiction psychologist typically treats patients with substance use disorders or substance-related health conditions. However, addiction counselors, also known as substance abuse counselors, can also provide support to loved ones of people with substance use disorders. Addiction counselors can provide education on substance abuse and recovery, help loved ones understand their loved one's illness, offer guidance on how to support a loved one through recovery, continue to provide guidance after recovery to help with sober living. Alright, isn't that interesting? Alright, we're going to screenshot this so we got it for later for our notes. Alright, now let's go on back over here to these, oh yeah, I forgot I was looking that up. Alright, so let's go on back over here. And we're going to look at this here medical records. There we go. This is some stuff I've been finding in different places, and that JP's been posting, and that Tracy Heifer girl has been posting. So I've been meaning to do a video about it, but then life happens sometimes. But I did work on the online protest stuff though, at least, so that was good. Alright, so let's look at this one. Alright, general information. Alright, it's got her name, unit number, date. This is from December 5th, 2022. Date of admission. But you know, if you really look at this stuff. Oh yeah, here we go. Right here. Here's the part I really want. Oh my goodness, y'all. I really want to show y'all this. Alright. So yeah. Alright. So general information. Date of admission. Date of admission 11/29/22. Date. Wait, hold on. See, every time I try to come and do this video today, I discover something different. And then I have to go back and recheck everything. Okay. So Mica Miller, unit, date 12/5/22. Count, date admission, date of admission November 29th, 2022. Alright, date of discharge. Okay, December 5th, 2022. Okay, alright, so that one makes sense. Alright, bipolar 1, reoccurrent manic episodes, severe. THC dependence, dependent personality disorder. Wait, that's all they had? Don't this sound familiar? Medical examiner report? So you mean to tell me that they had this information from November 29th to December 5th, 2022, and they had the information for, what was it, April, March 2024, but they didn't know that Michael had filed for divorce and had a restraining order against JP and had called the cops several times and had a bunch of police reports? Oh, but they didn't know that, did they? Okay. Alright, so hospital course. Other diagnosis, NA, which means non-applicable. Hospital course, clinical presentation on admission, bipolar history of present illness. Alright, I am not really sure why I'm here. Maybe because I was drinking too much water. Patient is 20-year-old female that presented to ED with police with increased agitation. Per staff, patient was crowning in the ED and was given PRN due to psychotic agitation. Patient is very tangible and require constant redirection. Bounces from possible pregnancy to her husband's. Wait, what? Patient is 20-year-old female that presented to ED with police with increased agitation. Per staff, patient was crowning in the ED and was given PRN due to psychotic agitation. Patient is very tangible. Require constant redirection. Bounces from possible pregnancy to her husband's snoring to increasing her H2O intake to Delta 8 gummies that really help her. They are natural. I have to do all things natural. Patient is very focused on religion, but is a pastor's wife and very active in the church. Patient is euphoric and describes feeling like she can fly and not be harmed. Does report 2 prior hospitalization. Most conversation and question. Patient diverts to conversations around her husband. Past psychiatric history. 2 prior hospitalizations. 1 prior attempt with firearm. Spouse reports recent non-compliance with medication secondary to not getting meds filled, followed up by WCMH, which we know who that is. Past substance abuse. Denies all except for Delta 8 gummies, which is like weed gummies. Social developmental. Lives with her husband of 5 years, high school grad, works at church with husband, has family in area, no kids, history of abuse, trauma, no. Alright, let's go to the next one. I thought the ED thing was funny. Alright, so we're gonna look at this one. Okay, I think this one might go. Oh no, this has got 2024 on there. Alright, let's see. Service date 2/19/2019. Alright. Chief complaint. Reason for visit. I've been doing real good. Wouldn't it be for follow-up appointment or medication refill or, I don't know, something. I didn't know that you go to the doctor when I'm feeling real good or doing real good. History of present illness. Patient seen for follow-up of bipolar DO and meds. Patient is in good spirits. Reported stable mood. No SXS symptoms. No manic symptoms. Remember, we just learned that word and abbreviation. discuss symptoms and warning signs in order to prevent further decompensation again. But she said she never I don't know, they can't see it, but never something. And then this shows how poor concentration and attention span she has since I review it with every appointment. Hold up now. What you mean it shows that she's got a short attention span? Ain't you supposed to review and do these things every single appointment? I mean, isn't that why you're there for the appointment? Like, okay, we're going to do this treatment plan for this. And, you know, if you get it, and then, I mean, I don't know. I feel like that's like an insult. Like, telling somebody they stupid because I had to remind you of something. I mean, like, come on now. Oh my God. Alright. How severe and extreme her symptoms were. She recognized that she had a lot of delusional thoughts when she, I guess, this is not making any sense. Am I just not reading this right, or? She recognized that she had delusional thoughts, manic, and she needs to listen to her husband when he raises concerns. Every time she comes with strange diets that she hears or reads online. This time she asked about starting a 5-day fasting once a month. We discussed how this could interfere with her lithium level and how dangerous it could be as she can become toxic. On the other hand, it could dilute the lithium and she can decompensate due to increased fluid intake. Taking medications as prescribed. Denies medication side effects, denies depressive symptoms, denies anxiety symptoms, denies manic, denies AVH, which we learned what that one was. Let's see, AVH. Look at my handy dandy notebook. AVH, we'll have to go back. Denies, alright, the SI and the HI is, taking yourself or taking others. Review of symptoms. General skin, sleep within normal levels. Interest within normal levels. Energy within normal levels. Concentration within normal levels, but up there you just said that she can't stay focused. Appetite within normal oh my goodness. Levels within normal levels. I gotta get used to talking again, y'all. I'm sorry. Alright, and then you see right here where they cut it off at, it says lithium carbonate 300 milligrams. Take 1 capsule by mouth 3 times a day. And then whatever that is, cut off, which looks like the same 300 milligrams. Take half tablet by mouth every night. Okay. Yeah. I mean, I'm not a doctor or professional or nothing, but that makes no sense. Okay, and I think this one goes to alright, date 2/11/24. Let's see, January, February. So this is February 11th of this year. Associations intact. Thought content. No delusions enlisted. Hallucinations denies. Memory short term, unable to assess. Attention is adequate. Concentration adequate. intellect, average per vocabulary, fund of knowledge, fair, insight, judgment, insight, fair, judgment, fair, strengths and disabilities, strengths, able to feed self, able to ambulate, can maintain some ADLs. Okay, I guess we got some more medical lingo to look up. Disability, medical we're gonna have to look that one up too. Poor insight. What's that mean, poor insight? S risk, detailed assessment, overall level, moderate risk, physical exam, alert, awake, no acute distress, pleasant, conversational, mental status normal. Wait, mental status normal? No respiratory distress, muscular, skeletal, normal inspection, painless range of motion, no muscle spasms, gait normal, neuro, CNS, normal inspection, normal speech, diagnosis, assessment, and plan, free text, A&P, bipolar, MRE, manic with psychotic features, will not restart lithium as patient openly admits attempting wanting to get pregnant, increase Seroquel to 50 milligrams BID and 100 milligrams QHS for mood stabilizer, which I think is the lithium. Patient resistant to other medications at this time. Yeah, I would be too if I was being drugged up like that. Dependent personality, do groups and therapy. SW to assist in obtaining collateral POA and durable POA on chart. Increase Seroquel and the lithium for mood stabilization. 21024. So 21024, 2924. To 1124. Alright, y'all are seeing the same thing I'm saying. Y'all see like these bogus pages and stuff that JP's putting out. And then understanding mental health. Yeah, JP, we understand you have mental health. Alright, and we just read this one. Yeah, we just read this one. Now, see, the difference on this one is, though, see where the names are redacted? That's all they did. And then they try to make it look like a new, see if it's the same date. They changed the date. Where's the date? Because this is the same thing, word for word. Service date 2/19/2019. Trying to find the other one real quick so we can oh, here it is right here. Service date 2/19/2019. It's the same exact thing. And this one is something that Tracy girl Heifer posted. Yeah, so it's got the same date and everything. So, yeah. That's all they're doing, is just redacting and acting or adding different of the acronyms and all that stuff. Oh yeah, this was something that Tracy had too, about lithium trying to go along with the narrative, you know. I don't know, she's also got a An advertisement for Regina Ward. I wonder why Tracy, that loves JP so much, will be endorsing Regina Ward. I thought Regina Ward was supposed to be helping Mica's family. Oh yeah, and would a doctor ever tell a wife to listen to your husband? No. A doctor would generally not explicitly tell a wife to listen to her husband, as it is not considered appropriate medical practice to take sides in a personal relationship. Their focus is on the individual's patient's health and well-being, not on dictating marital dynamics. Yeah, Tracy. Oh, what's this? Potential for abuse? In situations where domestic violence is suspected, a doctor may need to take further steps to ensure the patient's safety, which may include asking about the dynamics of the relationship, but not necessarily telling them to listen to their partner. Now, this went to this question here that I asked. Individual assessment. If a patient expresses concerns about the relationship impacting their health, a doctor may discuss strategies for communication and healthy boundaries, but will not tell them to simply comply with their partner's wishes. So tell me, JP, how are all these doctors and everybody coming to you and saying, oh my God, dude, she better take her medicine, she better take her medicine. But you were the only ones that could take her medicine, but in her medical records it says that she couldn't go pick them up, but then you picked them up and forced her to take them. I mean, your dots aren't connecting, JP. What a doctor might do instead: ask open-ended questions. A doctor may ask questions to understand the patient's perspective on the relationship and its impact on their health, allowing them to express their concerns freely. Encourage communication. A doctor may suggest strategies, I told y'all I got a speech impediment sometimes, for improved communication between partners, such as active listening and expressing a needs clearly. Refer to a therapist. If marital issues are significantly impacting a patient's health, a doctor may recommend seeking professional therapy to address the underlying problems. Alright. And there's like so much to say to this, y'all. Oh, y'all want to know who True Crime Ray is? I'm going to bring this to y'all too. I'll tell y'all who it is. Oh, and these are people that I found that were in that Waccamaw hospital. I'm still researching. But yeah, these right here are addiction psychologists. And I accidentally cut myself off, y'all. Trying to do stuff on here. Alright, is there anything else we need to go over on here? I think that was it. Yeah, JP, a doctor's not going to tell their wife to listen to their husband like that. And, yeah, I'm sorry that you have ED. I don't think Mica had erectile dysfunction, y'all. But I'm just going to finish up with that, and then if I come across anything else that we need to go over, I will add it into another video. Until then, thank y'all. Bye.